Good afternoon, everybody, and welcome to the webinar on how are South Asian migrant women in Canada overcoming employment challenges during this pandemic. I'm Marcia Akbar, a senior research associate at the SARC Migration Integration Program at Ryerson University. This webinar is a part of the blog and webinar series on Migrant Futures, which is jointly initiated by SARC Migration and Open Democracy. Our speakers have contributed to this initiative by writing 3 interesting blogs, which will be published on our website by mid-June. And today they will share some of the key themes from their blogs with us. South Asian women are one of the highly educated and skilled migrant groups in Canada. According to the 2016 census, 65% of them come to Canada with a university degree. And a small but growing number of South Asian women also come as principal applicants. Despite their skills, education, and employment experience, they're most likely to end up in precarious employment sectors. Those who are engaged in entrepreneurship also face numerous challenges. Our speakers today will talk about how the pandemic has intensified those challenges as well as provided an opportunity for these women to strengthen their resilience and find innovative ways to deal with their employment challenges. Our first speaker is Shutama Ghosh. She is an associate professor in the Department of Geography and Environmental Studies at Ryerson University. Shutama will discuss the entrepreneurship endeavors of South Asian women in the context of this pandemic. Then we'll hear from Vatsala Ilisinghe. Vatsala is a PhD candidate in policy studies at Ryerson University. Vatsala is also a medical doctor. She got her MD degree from University of Colombo in Sri Lanka. Combining her personal experience and research interest, Vatsala will talk about the challenges of South Asian women who are in regulated professions. And last but not least, we'll hear from Manjit Dhiman. Manjit is a senior vice president at Access Employment, one of the prominent settlement organizations in Canada. She has a long experience in the settlement sector. So based on her experience, she will talk about the challenges that South Asian women are facing during this pandemic and the strategies that Access has adopted to deal some of the employment challenges of South Asian women. Before hearing from our speakers, I would like to request the audience to post their comments and questions in the chat box. So first, I'm going to ask Shutama 2 questions. South Asian women in Toronto face adversity in their entrepreneurial endeavors due to the pandemic. And my second question is, what strategies are they adopting to overcome these challenges? And you have 5 to 7 minutes to respond, Shutama.
Thank you so much. Thank you, everyone. And yes, I am, of course, an associate professor in the Department of Geography and Environmental Studies, etc. But I am also a mother. And I have a 13-year-old who, from the pandemic, I was witnessing that she's, with her online schoolwork, etc., had the connection with the community as such had reduced. So that is when I started looking for ways to engage my little one and see, what options are out there. And from that little engagement, a can of worms, if you so to speak, opened up. So what I'm going to talk about, essentially answering Marcia's question, is what I garnered or what I gathered through all these informal interviews that I did. None of this has gone through the Ryerson Ethics Board, etc. So this is definitely in the plans. So to answer Marcia's question, I guess what I found so far, that there are 2 types of South Asian women entrepreneurs, those who already had established businesses. So this would include, people who were offering dance classes and people who were offering language classes to South Asian kids. And then there were those who were, prior to the pandemic, were actually in managerial professional jobs, and for some reason those hours were reduced, or they had, because the children were at home, the pressure of the family did not enable them to keep those hours, or personally they just simply didn't want to go out of home, and but work from home was not an option for them. So therefore there are various reasons why they took up self-employment. Now, why immigrants take up self-employment is something that is very well covered in the literature. That is not new. What is new is that the innovative ways these women are, the ways in which these women are actually carrying out their businesses. So I'll just give you 2 or 3 maybe examples, and that will probably answer your question. So I informally interviewed Anita, a woman who is actually a professionally trained person working for a large corporation, but her hours were reduced. Her husband is in the hospitality industry, and she always had this idea that one day that she's going to start her own restaurant or start her some kind of business. So what she then did as a result of that, and her children being at home, is that she then started a catering business. So the catering business basically means that people order online, and she makes the food at home. Of course, it is informal because she doesn't have the certification and other things that you need. And her husband then takes the food and then delivers to people's houses, and you can drop and such like that. So in this way, what she's doing is that she's supplementing her family's income, and managing all these different aspects of her life. She's taking care of her children, but also her underemployed husband, has joined in, which then means that they're able to reach a wider audience. So what the pandemic has then done is that enable these women who did not have a wider reach, had only their little communities, have now started all these different new Facebook groups. So if you do a search, if you're interested in Indian Pakistani food, you could do a search and you'll see tons of these groups have come out. For example, Indians in the GTA, Indians in Sudbury, these all over Ontario, these different groups are there where you can actually advertise your product, whether you're doing catering, whether you're selling other kinds of goods, and etc. But one thing that has not affected the catering business as much as it has affected those who are in fact selling saris or jewelry or ethnic products from back home is that as a result of the pandemic, their shipments are irregular. So as a result, a lot of the money that they have invested are now stuck, because they cannot sell the product, because it's not here because of the lockdowns. So that is a major challenge that they are also facing. And I would say that last but not the least, other than these economic challenges, it is the uncertainty. Whether they will be able to continue with this business once things open up. I think I should stop here because I'm just worried about the time, and I see there are 2 things in the chat. 5 minutes left. Okay, I'll stop here. I'm happy to answer questions.
Thank you, Shutama, for this really informative empirical information. I remember when I did my study on Bangladeshi women in 2014 and looked at their entrepreneurship, the social media was not in the picture. So their interpersonal relationships and exchange of products and networking, everything used to take place face to face and basically at the community centers and religious stores. So it's good. It's really interesting to see that the dynamics, how the dynamics changed, and especially the specific use of social media for entrepreneurship. So we'll talk about this during our Q&A session more. Now I'm going to ask Vatsala. So Vatsala, you are a medical doctor and you have lots of friends also who are a doctor. And based on your personal experience and your research interest, can you tell us what challenges and opportunities have South Asian women in regulated professions faced during the pandemic? And what needs to be done to address their challenges during the post-pandemic recovery period?
Thank you, Marcia. A very important question to raise, right? Although we've talked a lot about the pandemic's disproportionate impact on different groups, we have not talked as much about specific issues such as de-skilling of immigrant women in regulated professions, nor have we thought about solutions to them. It's at the risk of going back to the status quo and continuing as how we have always done in Canada. It was quite evident during the pandemic that there is a shortage of healthcare workers, especially nurses, doctors in Ontario and Canada more broadly when dealing with the pandemic, requiring the provinces to call out for providers from out of province and in some cases to even consider sourcing them from other countries. But we also know that there has always been a large group of healthcare trained immigrants in Canada whose skills are either underutilized or not utilized at all. We know that by 2019, it is estimated that there were about 250,000 immigrants with healthcare training, not working in the sector, while there were about 40,000 vacancies that were not filled. So majority of these vacancies were also in fields like nursing, care jobs, and medical technical positions that would have been normally filled by women. And if we look at the numbers, women and visible minorities predominate among those with underutilized healthcare training. And this is more so for professions where women predominate, such as nursing, health care aides, health medical administrative services. And furthermore, about 40% of with underutilized healthcare training are in Ontario. Now, the pandemic is an opportunity to look at the issue and find solutions to integrate foreign trained healthcare workers. A proposal announced to expedite a registration for internally trained physicians were really based on highly selective criteria, such as you already had to have a work placement in a hospital to benefit from this offer. These are criteria that would only benefit a handful of people because the barriers to enter regulated professions, whether it's healthcare or other STEM fields, are more systemic and long-standing. They range from requirements such as remaining in the work field despite not having access to it. And we know that a lot of foreign qualified doctors keep going back to their countries of origin to really maintain that continuous clinical practice. They take on survival jobs and they keep taking and retaking qualifying exams, all of which have been made quite harder during the pandemic due to changes in access to work, higher caregiving responsibilities, and lack of access to these training opportunities, all of which can only make the situation worse for immigrant women. As you mentioned, Marcia, really the number of women who've been migrating as skilled migrants have increased. And if you look at the South Asian context, based on my work in India, Bangladesh, and Sri Lanka, we see that out of about 45,000 South Asian immigrants to Canada in 2019, 35% were skilled primary applicants. That's like a 30% increase from the number in 2011. But the tragedy is that for women from less gender inequitable countries, participating in skilled migration and acquiring human capital comes at a premium, right? They have to overcome individual, family, community, societal level barriers to participate in education, the labor force, and the right to make a decision about migration. So what we have seen is that women who have applied and who face barriers in STEM and healthcare fields are accessing these pathways more and more. But the de-skilling that happens post-migration in Canada is really to lose that advantage and to reinforce some of the same inequalities that they have worked so hard to overcome. So then you ask, what are the solutions? The recently announced federal investments into the racialized newcomer women's program to retrain and skill development is really promising. It's a program that has been in effect and community agencies have had access to. And also the announcement of Canada-wide childcare plan in the budget will really help in the long term to improve migrant women's access to the labor force and more opportunities to advance their careers. But there has to be specific efforts to improve their access to regulated professions that has long been exclusionary to newcomers from less developed countries and regions of the world. If we really look at the foreign trained healthcare workers matched for training positions in Canada, it is clear that there is advantage and hierarchy based on country of origin and country of training, favoring those who have been trained in Western countries. Canada has been long looking for inward for solutions when we know that other countries like United States and Australia have created effective pathways to admit foreign trained healthcare workers into the workforce from the same countries that Canada has an issue with admitting to their health workforce. For example, in Australia, about 15% of their health workforce comes from South Asian countries of origin, something that we don't see in Canada. So these must be really considerations in Canada's post-pandemic recovery, looking at specific issues that affect really vulnerable groups that not only create the conditions or reinforce conditions that they have struggled to overcome, but make it sometimes even worse for them.
Thank you, Vatsala, for highlighting the challenges and issues of South Asian immigrant women and in general migrant women who are in regulated professions. And you know that in Canada, the scholars, the academics and the researchers have been talking about these issues for a long time without much change in reality. And especially during the pandemic, we have seen this, as you mentioned, the shortage of healthcare professionals on the one hand, and on the other hand, there's a waste of skills. So there are health professionals within Ontario whose skills are not utilized. So we'll talk about this later again. And so let's hear from Manjit Diwan. So Manjit, you have heard that Chutoma talked about the entrepreneurship context, and Vatsala just shared her opinions about the regulated employment sector. And you are working at the settlement service sector, and you have long experience in terms of dealing South Asian women, especially who are newcomers. So based on your experience, what are the unique employment challenges South Asian women faced due to the pandemic, and what initiatives Access Employment has taken to address those challenges?
Thank you so much, Marsha, and thank you, Sutama and Vatsala. This is a great honor for me to be on this panel and this conversation with you and your valuable insights. I have a slide deck. I was wondering if we should put that up, or otherwise I can just speak to it.
It's okay.
There we go. Okay, thank you so much. So yeah, I'm very pleased to share some information about our experience as an employment service provider, and what we see in terms of the barriers that South Asian women face, and especially due to the pandemic, what can be done. So next slide, please. So first of all, I think, the question is an obvious question, which is, has the pandemic made things worse? And I think that we can all agree, and we know that definitely it has. It has made, it has had a negative impact on, job seekers across the board, and certainly for those who face barriers, who already faced barriers, those barriers have now been exacerbated. And I think one of the biggest learnings that we've all learned from the pandemic is that that our society is not equal, and that the pandemic has unproportionately affected racialized individuals and women as well. So the intersection for South Asian women of facing barriers that typically women face, and then on top of that, barriers that racialized individuals face is very challenging. Next slide, please. So some of the common barriers that newcomers face when they come to Canada, and again, specifically South Asian women, but this is generally true of a lot of internationally trained professionals and newcomers, but certainly a lack of information and guidance about job search and about the labor market, a lack of recognition of foreign credentials, which Vatsala spoke about, but that's true in various professions. But not only credentials, but just even a lack of recognition of international work experience. Sometimes language can be a barrier for some individuals, although many South Asian women and immigrants have very fluent English. When people are new to Canada, things like references, having a network of professionals that they can speak to, that they can get references and referrals from, is a big barrier. And then that, as well as the fact that we know that, things like even just names, we've seen research where just the name on somebody's resume, an ethnic name, can influence whether an employer calls that person for an interview. So certainly there are prejudice, stereotypes, and discrimination, a lack of social and emotional support, health and well-being. And of course, something that my co-panelists have alluded to as well is just the responsibility for home and family and how that's affected women generally and specifically South Asian women. Net access, I think just by the numbers alone, this is an important target client group for us. About half of the participants we serve are women, and of those women that we do serve, approximately 40% are South Asian. So again, a large number of clients. And we know that India, for example, is the #1 source country for immigration in Canada. So it's not surprising to know that we have a large number of South Asian women who are struggling. Next slide, please. So, I won't go into too much detail. It's just exactly what I just mentioned, which is that we know, according to the data, that South Asian population has been affected by the pandemic in terms of unemployment rates among the highest. And we know that women are affected by unemployment, and again, amongst the highest in terms of layoffs due to the pandemic. So that intersection of gender and race has a significant impact on South Asian women. Next slide. So just going to speak to a little bit of the common issues that South Asian women face. Again, another area that we have, an area that we've touched on already, and that is that South Asian women are often compelled to take on survival jobs, which may be far below their skills and experience. And this is not just even for, professionals such as doctors, but even those that have, as we know, university education, whether it's in finance, accounting, IT, whatever the case might be. I think generally newcomers, again, in general, tend to take on survival jobs because they are led to believe that they won't be able to get a job in their field. So they head in that direction. Interestingly, in the pandemic, even that has become less of an option. So for individuals who, maybe for financial reasons and for whatever reasons where they do feel they need to take on a entry-level job or something to keep them going, we know that the frontline jobs in hospitality and retail have been practically eliminated. So that leaves fewer options for South Asian women. So some of the things that we're doing is we're customizing the services, and we're making sure that we're responding to the individual needs and looking at the goal and the education and the qualifications of each person and helping them to find work that is commensurate with their skills and qualifications. Another issue, again, that we've touched on is the fact that women and South Asian women have a prevalent responsibility for home and family. and that what we're doing is we're trying to make sure that our services are flexible and accessible to South Asian women, given the constraints that they're facing with their schedules, taking care of children and elders in the home. And then finally, the next slide. And one of the other challenges I think that we're really seeing is that South Asian women are, again, according to some research, are facing some of the highest levels of anxiety and stress. And we can see that in this particular research. But one of the things that we're doing as an organization is we are creating networking and mentoring opportunities for South Asian women. And this really gives them an opportunity to gain support, not only from Access and our staff, but also from peers as well. And this has been very helpful. Thank you.
Thank you, Manjeet, for sharing the strategies that are taken by Access to address some of the employment issues of South Asian women. So before taking the questions from the audience, I would like to discuss more on the three blogs that you just shared. So, and I would like to know your comments on each other's views and experiences. So, Ashutama, I would like to ask you, what would be your comments in terms of what Vatsala said about the the employment challenges of highly educated women who are in regulated professions, and also Manjeet talks about increased responsibility of family and home during the pandemic. And we know sometimes in entrepreneurial literature, it is suggested that women often adopt entrepreneurship because of these reasons. So have you noticed that is the case, or you have seen something different?
Definitely. I mean, there is a huge connection between, deprofessionalization and self-employment, which I think Manjeet talked about. And that is, again, as I'm not saying that it's not important. I'm just saying that that is something that is not new, because that is where all these issues of self-employment and the debates around whether self-employment is a good thing or a bad thing for immigrants have emerged. And I think there are a lot of people here who I know, or their work I know, have worked on that area and sort of were able to advance the knowledge in that sector. Definitely, when we talk about the COVID-19 pandemic, as the stats show that visible minorities have been adversely affected, and it's not surprising that this not only affected people who are in the low-skilled jobs, but also women who are engaged in the high-skilled sector, and that is pertaining to, as I said, it's not just. I think it's important to realize that this move toward entrepreneurship may be not just because of the external factors, but how those external factors are affecting the issues that are at the family level, at the household level. So I think that there needs to be that connection between how external factors such as loss of employment, or the fact that there are no daycares available, or that the daycare is available only on a few days, how those things are affecting women more than men, and how that is then making them choose to not really choose, but anyway, making them pushing them towards entrepreneurship. One thing that I wanted to talk about, and I just stopped because of lack of time, I want to bring that back. And one idea that's particularly fascinating is the way in which many South Asian groups and some women have started this way of engaging children. So one of the programs with which I am involved personally, and I do go and teach there sometimes, is called the Creative Buds. And what they are doing is that they're raising awareness of indigenous children. They're raising awareness of about Hindu religion, Islam, racism, and all kinds of various topics. And I'm very proud to say that in Pakistani, Indian, Bangladeshi community, these sort of online, engagements are essential, particularly for those people, mothers who are now having to work from home full time, in addition to doing other things. So I think this is just simply fascinating way of resilience. And I'm not saying that the dads are not involved, but definitely there is a huge gender imbalance there.
Okay, thank you, Sutama. So I would like to know from Vatsala, do you have any comments on what Sutama said? And also, Manjit talked about the services that Access Employment is providing. So do you think that there is a potential, or there could be a link between the services and the pathways of regulated, pathways of South Asian women who are in regulated profession, so that they can practice their own occupation or own profession?
I mean, absolutely. I think all that we do, all that we have been doing is really helping women towards having better access, being able to find work, improve their skills, and then access these pathways. But I think the key is that not limited to South Asian women, but every immigrant who's trying to access regulated professions is the regulatory barriers, right, which are insurmountable. You cannot overcome them. If you don't have a training position, you cannot progress in your career. And it's true for other STEM fields. And I think one of the things that we have to talk about is how is immigration into Canada sold and promoted in other migrant sending countries. If you go to a country like India, Sri Lanka, Bangladesh, it's like, come to Canada and you can be a nurse. It's advertised with a picture of a nurse holding a stethoscope. There's really not enough information out there to say this is the reality. These are the barriers, and this is how long it's going to take for you to access these regulated professions. And I think somebody raised a very good question about the transnational support systems and how is the transnational linkages and support systems have been affected. It has also affected the information going out. I mean, really now for people accessing skilled migration pathways or other pathways for migration to Canada, there's very little information available from official sources, right? So there is this struggle of people not knowing what they are getting into, and all that the work that we do in Canada is amazing, but there has to be more information out there for those struggling to really overcome those barriers in the regulated professions.
Thank you, Vatsala. So we're going to hear from Manjit. So Manjit, during this pandemic, have you noticed, whether South Asian women are looking for help and support to start a business? Or in general, do you have South Asian newcomers who actually look for that kind of support for starting a business and operating a business? And if so, does Access have any plans or programs regarding entrepreneurship?
So yes, actually we do. So thank you so much. And I think that is an option that women, newcomer women, and especially South Asian women do explore. And we have a program called Entrepreneurship Connections, which really supports newcomers with starting up their business in Canada. So this is a really good support and specific program that can help. I wanted to just comment too, actually, I've seen some of the questions and it's in the chat, so thank you for that. And I wanted to touch on bridging programs. Somebody had mentioned, asked about that. And I do think that the Ontario Bridge Training model is very important because of the sector-specific approach that it uses. And so this goes back to our discussion about helping people to get jobs in their field. And so that program really does allow us to look at just beyond job search and employment services, but really look at what are some of the specific skills and certifications that are needed in that profession. It looks at, of course, credentials and their background education. It also allows us to do our job search in a more sector-specific way. So looking at what are employers looking for, what are their expectations and their processes. So really customizing the job search to that. And I think that's really important. And we've seen huge success with those programs. So we're of course advocating and hoping for continued funding of those programs. I also wanted to speak to a comment I believe that somebody put in the chat, I think it was Amin, about employers. And so it was to the point that, sorry if that wasn't your comment, but I think I noticed as the chat was going by. So somebody asked the question about, in addition to helping the job seekers, what are we doing to help and address some of the systemic barriers that newcomers face? And I think that's really, really key because we know that's one of the challenges that people face. So our work is definitely twofold. So while we work with the participants and help them to prepare, we're also working with employers to engage them and to give them the opportunity to get to know our client base and to understand that many of the myths or misperceptions that they have of newcomers are often incorrect. And so just by having the opportunity to interact, to mentor, to support our client group, they have sort of an eye-opening experience for themselves to really see the talent and the qualifications that newcomer talent can bring to their workplaces. And we're also helping them to look at their own hiring practices. In fact, one of the projects that we're doing right now, funded by Canadian Heritage, is looking at best practices for recruiting and onboarding racialized minorities.
Thank you, Manjeet. And I'm seeing that Shutama would like to add something. Yeah, go ahead, Shutama.
I think when we are talking about South Asian women entrepreneurship and the pandemic, I think it is important rather to stress that it is not just about the recent immigrants who are facing this issue. I think it needs to be stressed that this is something that visible minority women of South Asian origin, having lost hours in their jobs, having to supplement family income, etc., is not necessarily a new immigrants issue. Not that Manjeet is saying that. I'm saying that it's important to realize that people who have been here 15 years, even 20 years, are also facing the similar issues. And therefore, whether you see this as a resilience, whether you see this as a problem that needs to be, addressed at the core in terms of policy planning, is something that needs to be thought about.
Thank you, Shutama. So we're going to take some questions from the audience, and you have already addressed a few questions from the chat box. So I'm going to ask, so there is a question by Jasmine, and she's talking about that most of the challenges that you have discussed are common for racialized immigrant women. So is there any particular challenges that only South Asian women face? Are there any unique challenges for only South Asian women in Canada? So Shutama, respond. But I'm seeing the hand.
Oh no, sorry, the hand is up from before.
Okay, no worries. No. So any of you can respond to this question.
I mean, I think it's a very important question, right? We always ask the question like, how is it different for different groups? And somebody also raised the question about racism and sexism in the regulated professions and what are we doing about it? So there's always been, and we know there's a hierarchy, a sense of hierarchy of races, cultures that we are placed upon people and then decide their worth based on that hierarchy. And when it comes to South Asian women, there has been all this stereotypical view that they're dependents or they have come to Canada as dependents, and therefore how much should they be valued or how much is their worth? And I think this sort of permeates across regulated professions or even entrepreneurship and the work that they do. And like somebody raised, are there any statistics or numbers to speak about the success from these programs or what's the outcomes of these? And there isn't really. And that would be why in some cases it's hard to challenge these stereotypical views or to demonstrate that South Asian women are no longer predominantly a dependent category. Those who come here are really skilled and trained. So that's, I think the key is like one of the first things we can do is really talk about it or write about it and to sort of put out the data out there to show. And some of the work that I do now is really about talking about how much of South Asian women that come to Canada are skilled. And they're skilled even more so than from other settings in a sense, because they have to overcome many more challenges than they would have had to overcome if they were living in their country. So it's really about writing and talking more about it and creating that awareness and sort of dismantling some of the stereotypical views.
Okay, thank you, Vatsala. So we have a few questions from Anna. So I'm going, stating those questions. So was the pandemic emergency just a magnifying lens of previously existing challenges, or did it bring new ones? And also, did it bring some new resilience or new type of entrepreneurship, as Shutama seems to signal? And also, what do we make of that as we leave the pandemic behind? Can we see some potential there? Any of you can?
Yeah. Maybe I can start by saying that yes, I think that what I think is that many of these barriers existed, and maybe people weren't aware of it. We weren't talking about it as much. I think for an organization like Access, which has been helping newcomers navigate through we've seen these barriers for a long time, and I think the pandemic really highlighted and exacerbated those barriers. So I think one of the other elements that I can speak about with South Asian women and a barrier that's maybe specific, although again, this may be common to other cultures and ethnicities, but I think having the extended family. So, we've talked about children and parents, but a lot of South Asians are living in families, units that are even broader than that. So often with their siblings, nieces and nephews. So having that kind of extended family is very common. And so again, the pressure that it puts on the family that you're taking care of and having to be at home in a lockdown and so on. So I think that's also a unique element that South Asian community is facing.
Thank you, Manjeet. So there's an interesting question by Nisa Ali. She's asking, in Pakistan, men whose wives work are considered inadequate in terms of being able to provide for their families. Mm-hmm. So do you encounter this among immigrant women?
Sorry, I'm already unmuted, so I can just speak to that a little bit. So one of the things we often see is that when a family comes to Canada, we do see that the priority is often for the men to find work first, even if the women are in that family maybe have even more potential, or maybe the type of work that they're looking for can be easily found, but they don't look at it that way. It's definitely the pressure for the men to find work first. And in cases where maybe that doesn't happen, there is, yes, that pressure that where where if the partner, the man, is unemployed, women are working, it really it affects kind of the dynamic of their family, and that's something that they're not used to, not only again within their family, but again the pressures from outside from outside their family.
So thank you, Manjeet, but you have I have one question for you that is asked to you by Amina Jamal. So she's saying that it seems that most of the strategies or the issues that you have discussed are focusing on employment problem, and that can be addressed by training and retraining the migrant. So do you think this is an appropriate response to the real issues of systemic racism and sexism?
So I think it's part of it, because I think this is one of the things that we want to do to prepare our participants for the workplace. But as I mentioned earlier, I think it's definitely, we recognize that that is only half of the work. And that the other half of the work is really working with employers and looking at the workplace and how workplaces and businesses can adjust and onboard more effectively women and South Asian women and other racialized minorities. So this is really important part of our work. And I think one of the other things that the has come forth in the pandemic, maybe that we haven't touched on, is how the workplace will be changing in terms of work schedules, remote work, and so on. And I think this may be an opportunity for us to look at the fact that the typical 5 days a week, 9 to 5 work week is probably kind of modeled after men-led labor market. And so that we really need to look at how this might be an opportunity to change that, so that women have an opportunity to participate in a way that is more conducive to their needs as well.
Thank you, Manjeet. So now we have a question for Vatsala from Melissa Kelly. She's asking, why do you think provincial governments, regulatory bodies, and other stakeholders have done so little to address the barriers some newcomers face to foreign credential recognition?
That's the $1 million question, right? Because like I said, if we look at other migrant receiving countries who bring in migrants with the same skills from the same countries of origin, why have they been able to integrate a higher proportion of healthcare providers into their systems and not Canada? And so, as somebody raised, like systemic and institutional racism is like the background or the foundation of it. But also the other thing is there is not really much public or policy space to bring up these issues. Who's going to bring up these issues? Who are the sort of the policy entrepreneurs or advocates for these problems or issues? And this is something that we have not found. I know there is a group of internationally trained doctors who created like a Facebook group and advocating for their, even during the pandemic, advocating for them to be absorbed or given a place in the pandemic response. But other than that, there has not been this space for organizing or to advocate for their rights and to really push governments or agencies to look at how many they have integrated, how many people they have absorbed into their systems in the past few years. So there's more work to be done. People who do research in this area, people who work in the area have to write about it, have to look at the numbers and really make a case for how inadequate the Canadian response has been.
Thank you, Vatsala. So we have another interesting question from Tanya Das Gupta. Just let me find it out for you. I just lost the question. Okay, so have accreditation in essential work been loosened under pandemic needs, such as for nursing, emergency services, and why that's so? Because in some cases, the accreditation requirements have loosened, right, based on due to the pandemic, for example, for nurses and other essential workers. Do you want to respond?
I don't think that we know that as yet. I mean, we read in the newspapers that that the doctors will be hired, and there was an obvious concern that so after the pandemic, these people who are being hired as doctors will no longer remain doctors, or these nurses who are being hired will no longer remain nurses. There was this question. I don't know if. But I don't think there is and I think this is a very important question, but I don't think we know that as yet. I haven't at least come across any research on this.
And if,
Um,
sorry to add to that, I don't think the response was like a policy response. It was more like, oh, let us admit a few doctors who already have physicians or nurses who already have a working relationship with an institution to expedite their registration through these programs. So that was not really looking at existing barriers to registration and creating a sort of system-wide response to it. It's just making a response just because there has been a call for it. So I don't think it has loosened the accreditation in essential work. It just has just made it seem so, right?
Thank you, Bachala, for sharing your comments. So we have some interesting comments in the chat box as well. I'm just reading a few because you might have some insights into these comments. So one comment is from Parveen Amlani, and she is saying that I think racism and discrimination among South Asian remains high, regardless of number of years they're in Canada. So I think Shutama already mentioned about this a few moments ago. Also, there is an interesting comment from Amina Jamal, and she has written that toxic nationalisms, patriarchal ideas about culture, class, and gender deepened due to colonial and post-colonial militaristic violence or partitions within and among those who identify as South Asian, seeping from the mainland is a specifically South Asian issue that impacts on women in many ways. So what she's talking about, that is not just what happens after coming to Canada, but also all the historical, cultural, patriarchal context from the countries of origin that also migrate with the women as well. So do you have any comments and any insights into these comments?
I just wanted to maybe say that, as much as it is important to look at the specific needs of each community and each demographic, and that's what we're doing today. And I think that's very important. But at the same time, it's important for us to be allies to groups that are facing similar discrimination and pressure, so that we're working together to combat some of these systemic barriers. So certainly, anti-Black racism has been at the forefront, looking at Indigenous rights and some of the issues that have arisen. Those are so important, and I think it's so important that we as South Asians are working closely with those groups as allies, and knowing that we're working for the same, we're all aiming for the same outcomes here, which is that equity is so important. And it's so important for us not to be divided and to say, okay, well, that's only true for this or not. I think we really need to look at some of these broad barriers, broad issues around systemic racism, and look at how we can be allies together and working together for social justice.
Thanks, Manjit. We have few minutes to take another question that we received prior to the webinar from one of our audience. So what kind of community practice we can do to stop or improve the current condition of following into the habit of taking low-paying jobs among South Asian women?
Yeah, it's a good question. It's a really good question. And I think there's so many layers to that, in terms of, number one, making sure that we're, supporting and encouraging women, South Asian women, to really take a look at what their qualifications are and getting a job that's aligned with their field. But I also think that some of our broader advocacy work around salaries and wages of frontline work, especially where there is, a higher proportion of racialized and women in those frontline positions, that we really do need to look at how we advocate for increased wages and better compensation in those areas.
Yes, go ahead.
I may have two comments. One comment would be that it's probably not totally, following, not really following Manjeet's comment. I just wanted to make two observations. One is that this idea of what is formal versus informal business needs to be better understood, and needs the lines that, oh, if you pay tax, if your particular business is registered, then you are a formal business, otherwise you're an informal business. I think these issues where the government, so to speak, doesn't get enough revenue when these informal businesses come up, is an important issue. But at the same time, I think there needs to be some kind of conversation in the lines of how can we reduce this gap between formality and informality? What needs to be, what kind of, help can the government do so that these women don't have to be in an informal business and can actually declare their income, so I think that is one very important aspect. And there's another a very interesting question by Michelle Nigwen, I think, that I read in the chat, and that's regarding the transnational connections. And I think this is not the forum probably to discuss that, but there's a lot to be said about how the transnational connections have enabled South Asian women to show resilience, how their parents and their cousins are helping them. At the same time, they are also helping them back home by shipping those products and selling them here, and then sharing some of the profits with people back home. I think those two are some of my observations.
Thank you, Shutama.
I had just mentioned in the chat that I do have to drop off for another meeting. So I just wanted to thank everyone for joining and for including me in the conversation.
Thank you so much, Manjeet, for your contribution to our blog and webinar initiative. And take care. Have a good day.
Thank you.
Okay, so we have maybe a few more minutes to address one more question that we received prior to the webinar. So, Colorado Poverty has been calling for strong employment equity legislation in the province and in the country to combat discrimination, such as gender and race-based wage gap, as well as raising the floor on employment standards. For example, increased minimum wage, paid sick days, expanding who is covering by the employment insurance. So what do you think about these types of legislative changes in support of South Asian women? Do you wanna? Yeah, Fatshala?
Yeah. I mean, equity, employment equity for everyone, like we were discussing, it's we could not separate the issues of different visible minority groups and say one is bigger or greater than the other. It's just working together. So as allies, we would be stronger in advocating for having equity in employment, lack of discrimination in the workplace, and ability to advance your career, whether it's regulated or unregulated professions, right? And I mean, this is a window of opportunity in terms of creating a room for these policy changes as we go into a post-pandemic phase where everyone is going to struggle with getting back to work and finding work. There is also room to advocate for changes like this. So it's best for everyone.
Thank you, Fatsala. So we are running out of time. I would like to thank our speakers, Shutama, Fatsala, and Manjeet for sharing their valuable insights, and also the audience for attending the webinar and raising important questions. So in conclusion, I would like to say that this webinar is not the end of this conversation. We'll continue to talk about the diverse, a wide range of challenges that South Asian migrant women are facing in Canada. And our objective is to create a collaboration between migrant women, settlement organizations, academics, researchers, and policymakers, as well as employers, so that we can create a holistic approach to dealing some of the challenges that we have discussed at the webinar. So we'll continue our collaboration even after this webinar. So everybody have a good day and take care.